We're back on the road. Hello to all our fibromyalgia and lupus friends out there. This is the Fibromyalgia Impact Tour, something new that we're going to be sharing with you today. We're going to be talking about functional medicine and doing our educational part of the tour. So if you're tuning in live, please post and let us know where you're tuning in from and how, and continue to be interactive too. So let's start out with introductions. I'm Melissa Tolwer from the Support Fibromyalgia Network, and I'm going to be presenting today.
Yes, we are so excited to have you presenting today. I am Estela Mata. I'm one of the co-founders of Looms for Lupus, a nonprofit organization that my sisters and I founded to support those living with lupus, overlapping conditions, and so much more. And I'm just excited to be here today. Good morning and good afternoon, everyone. And today, our special guest is going to be Melissa. Melissa Talwar is the executive director of the Support Fibromyalgia Network, as you guys may already know, but she's also a board certified functional medicine health coach. And she's going to be talking a little bit about that. She's also a Walsh Protocol certified health practitioner and a Recode coach. So Melissa, you're going to tell us today all about what all of these titles mean. So I'm excited to hear and learn more about what functional medicine is and how we can utilize it for lupus, fibromyalgia, and other chronic diseases.
Well, I'm really excited to share, and shout out to Crystal for joining us and Colleen from Detroit. So anyone tuning in, please let us know where you're watching from and we'll give you a shout out too. I think we'll do Q&A at the end, so long as I don't take up too much of the hour with our slide deck. But I'm excited to share this information with you.
Yes, and we're excited to hear about and learn more about functional medicine because I keep hearing that term, functional medicine, and it just seems like it's a lot. You know, you hear it a lot, and it's something that I know you are very passionate about. And I want to know, how did you learn about what functional medicine is and what made you decide to choose this path?
Well, it's interesting. I mean, I talk about it here. I've sort of felt like all my providers have given up on me and weren't sure what to do. I mean, I was diagnosed with fibromyalgia early on. Always struggled with my health as a kid, but then at 14, it changed over and I was left in chronic pain. So I just kept declining and declining. And it's like, okay, symptom after symptom, diagnosis after diagnosis, medication after medication, nothing was helping me. So I stumbled upon this idea and the concepts of functional medicine. And this is what drove me to utilize things. And I'll talk about it a little bit more with the Walsh protocol and the Bredesen protocol, which both use functional medicine principles. But I think what we're going to get into too is some of these principles of functional medicine and using those tools to kind of help give the power back to us and get our health back on track, and understanding all these concepts of interlocking physiology and whole body medicine. Because whether or not we'd interchange functional medicine, integrative medicine, that's the name. But what we're looking at today is more of the concepts, because I know that there's different, I don't know, some people have had different experiences with functional medicine. And if you have, please share your comments. I know I see Melissa has had functional medicine changed her life, which is awesome. So you're finding the right practitioner that really understands functional medicine. But I know sometimes it can be expensive because it's not clear cut, whether it's covered by insurance. So these are things we're going to talk about today. But I'm going to talk about it too from a more patient turned health coach, talking to patient about functional medicine, because most of the time these presentations are given to clinicians on training clinicians about functional medicine. But I want our communities to understand the concepts so that you can empower yourself to also coordinate with your doctor, regardless if they're functional medicine trained, as long as you understand the basic principles of what we're getting at. No matter what the title is of what medicine, that it should be incorporated into just regular healthcare. That's what it's really all about, and just improving and empowering our lives.
And that's amazing that you mentioned that, because that was going to be my first question. Is I don't want people to think that functional medicine is the the one thing to do and then leave your doctors. It's something that you can use and combine together, right? So it's not like, okay, this is what I'm going to do now, and stop, seeing my regular doctors because this is what I'm going to do from now on. So I know you've prepared some slides, and if you can just share those with us so you can help us, one, learn more about what functional medicine is and how we can utilize it with our care.
Yeah, I'm happy to get. Oh, I better. I'm starting to get feedback, but Estella, feel free to interrupt me at any point in time if you have questions. I know we'll take some questions at the end, but I will dig into the slides. So, is my audio okay now? Just give a thumbs up. Okay, so let's get the slide shared. Okay, so this is basically Functional Medicine 101. And again, I'm going to be presenting from a different perspective. Normally, this is presented to clinicians. So bear with me with some of the topics, but feel free to ask questions. And again, it's more about the concepts of all of this. And so that way you can empower yourselves with this knowledge. So functional medicine determines how and why illness occurs and restores health by addressing the root causes of disease for each individual. Now, this is the definition from the Institute of Functional Medicine, and you can learn more at ifm.org. And it's a good place to find other resources, and you'll find some of the documents that I present on the website as well. They also have a portal to look for other healthcare practitioners who are trained in functional medicine. So you can look through that, and they are continuing to educate other providers to get them to understand functional medicine. So that is the head resource. And I did do coaching through FMCA, which is Functional Medicine Coaching Academy, affiliated with IFM. So I really dove deep in my education of functional medicine. Now, we talk about the functional medicine model, and what we're really getting at is the heart of empowering patients and practitioners to work together. Wow, what a concept, right? So this is kind of like what we just need in healthcare in general. And I really think right now is such a pivotal time because we're empowering all of you with this knowledge. And I think some of us feel like we have to be our own doctors. We're digging into the information as much as we can, and we're actually teaching our practitioners more of what we learn. And I just want to say that that's okay. Hopefully you have an open-minded practitioner and you guys can work together. But this is really the goal, is like bridging that gap, because healthcare providers, they're not our enemies. We really need to work together. And I'm not sure where the disconnect came in. I have some assumptions on how we became so divided, but understanding this model of care is super important. So when it comes to functional medicine, we're talking about individualized care, so personalized medicine, patient-centered, so the patients are at the center of the circle with the healthcare team, like collaborating around them, but it's all about the patient. It's science-based, so we're doing research, it's evidence-based, and then detailed types of information. So we're getting at really all this approach of like underlying causes of disease and promoting optimal wellness. It is so detailed that we're going into each patient's genetic, biochemical, and lifestyle factors so we can leverage all that data to direct a personalized treatment plan to improve patient outcomes. So here in this sense, we're moving beyond just treating the symptoms, which again is what we're finding. We just keep treating the symptoms with a new medication here, new modality here, but we're not looking at everything comprehensively. I really love this image, and you just have to search for the functional medicine tree because it was hard to fit in here. But it really illustrates what we're talking about when we mention addressing root cause rather than symptoms. And we can become oriented to identifying the complexity of disease. And they may find that one condition has many different causes, and likewise, one cause may result in many different conditions. So as a result, functional medicine treatment targets the specific manifestations of disease in each individual. Now, you can see from the tree, like, okay, you see all these roots, right? And they're coming in, you have stress, nutrition, exercise, like reinforcement, relationships, like any of those traumas. And if anyone has experience in gardening, you know that the roots take up all the nutrition and like nutrients. It has to be well watered. We here in California, if these trees don't get, because we have a drought, they don't get enough water, they fall over, or they get a lot of disease prone. So this is kind of what we're talking about in our body systems. So all these roots affect everything from above, and then you have genetic predisposition, and it all leads to the top where you see all the signs and systems and the organ system possibly dysfunctions. But I love this graphic because it's also something that we can all relate to no matter our diagnosis. And this is where we become so similar to each other rather than distinct. And it's a hard tool to understand because so many of us put ourselves in sort of boxes, or we've been treated that way based on our own diagnosis. But when you dig deep into like all these causes and similarities, like we talk about it, pain, fatigue, just all these stomach issues, like we can all relate across the board no matter what we're diagnosed with. If we're diagnosed with fibromyalgia, lupus, but at the core of it, we can get to the basic fundamentals of what's going on in each of our disease states and really relate to each other in that sense and start looking at where our commonalities actually are. So that's why, I mean, we definitely maybe can share a separate link when it comes to showing this tree, because I really love some of the principles at the bottom. And then we'll dig into the tools a little bit more too. So some of the tools that we talk about in functional medicine, or you might have already filled out if you've been working with a provider, or a provider might have filled out for you, is the functional medicine matrix and timeline. So functional medicine introduces a focus on these interconnected biological systems in contrast to independent organ systems. So we see this all the time. You go to the GI doctor, you go to the endocrinologist, they're not talking to each other. Rheumatologist, your primary care is supposed to be the one maybe helping you organize it. But again, you're like trying to maneuver and you're jumping around and like no one's talking to each other. So that's kind of how we've put our own body systems, and we think that that's how it works. But we know we're like, our body is so interconnected with each other and we can feel it. Like if you have gut issues, you might get joint pain. So it's all connected. So this is where functional medicine looks at that interplay of physiology and function. Here is the matrix, and this is something that practitioners generally look at when we're looking at the whole picture. So we take a medical history viewed through the lens of what we call ATMs, and this is not somewhere where you can withdraw cash. It's the antecedents, triggers, and mediators. So with the antecedents, we're looking at predisposition, like other factors that we never had control of before we were given birth. So things like genetic factors, genetics are not our destiny, but it is something that we are born with and we cannot change. We can change things based on lifestyle factors. And then we look at triggering events. So any activators like a surgery, infection, trauma, or toxins. And this is also unique to each individual, because one thing that we talk about is like something like IBS. Some people may have gotten IBS symptoms that they noticed from like a stressful job. So they left a stressful job and they started to notice all these IBS symptoms. Or some people got a really major like stomach bug or infection and left, maybe they healed from that, but ended up with IBS symptoms as well. So the label becomes the same, but how you got there was very different. So that cause. So these are the things that we dive into when it comes to functional medicine. The other thing that you do have a lot of control of is these mediators. So these are contributors that maybe keep your symptoms going, keep that fire burning, keep the autoimmune cascade going. And this would be like things like poor sleep, chronic stress, poor nutrition, ongoing toxin exposure. So as doctors go through this, they design this whole portal. And you can even do this too, because I know there's some biohackers out there like myself. So just understanding how this system works in this chart. And an example of this, maybe how we contribute to dysfunction sometimes, is like, just imagine you're diagnosed with fibromyalgia, which many of you understand. And fibromyalgia is not only just pain. So you have fatigue, loss of energy, decreased exercise tolerance. So that factors into the energy that you see there. So energy regulation, mitochondrial dysfunction, but also, we talk about it a lot, abnormal hormone levels, sleep-wake cycles. So that's part of the communication channel. Digestive issues, gas, bloating. So that's where assimilation comes in. And then possibly reoccurrent injuries or bad posture as we're all sitting at our computers. So this affects like the structural integrity. We have brain fog, lack of ability to concentrate, which actually dives into both energy and communication. So this is where like all of this can limit the way we handle our everyday life. And looking at it this way from a systems approach really understands the complexity of what we have to do and hopefully helps to understand where these imbalances are and see that systems are really interrelated. Now, the bottom of the matrix is something that I focus on as a health coach. So those are the modifiable personal lifestyle factors. But you don't need to like have someone do these. These are things that you can actually start right away. And they have a really significant impact on all that you see above the chart. So sleep, relaxation, exercise, movement, nutrition, stress, and relationships. Although sometimes I leave out relationships because those are the hardest to like manage. But things like just sleep hygiene, getting some relaxation in, movement, like just moving your body to your ability. And then of course, something I love is like nutrition and how nutrition plays a role with this, stress management. So those are all factors that you can actually change yourself. And it really affects the top of the matrix. And I'm not even looking at the comments, so we'll take questions at the end. I apologize. I'll just go through the material as fast as I can. So I understand I might be going really fast. I want everyone to kind of sit with this question. So when was the last time you felt well? Because this is a core question we ask in functional medicine quite a bit. And everyone's answer is going to differ, but this might lead you to some of those trigger points, triggering events, or aspects of like, wait, as a kid, I haven't felt well at all. Like I was one of those kids who was constantly sick and stuff like that, which this honestly, in my experience, helped me make sense of what happened because I never knew. And I felt so guilty and kind of punishing myself that I got sick at 14. But going back in time, I understand things better than ever because I was kind of a sickly kid all the time. So it gives me this perspective. But then not only when you like used to feel well, but can you imagine actually visualizing yourself feeling well again and what steps you can take to like improve wellness? So just sit with that question for a while as we go into the timeline. Now, the functional medicine timeline is a graphical representation that allows yourself or clinicians to identify factors that predispose, provoke, and contribute to pathological changes and dysfunctional processes in your own physiology. So we're going to talk about like where you were born, what was going on. Do your parents or grandparents have any health conditions? So we're looking at this, even if anyone likes all the ancestry, this is more like your health ancestry part of it. So if you have autoimmune conditions running into your family, you would note that in the antecedents part of the timeline, and you would take note. I mean, this is when you go fill out at the doctor's office, they always ask you those questions about your relatives. But this gives you context of like why it matters. And even like how you were born, were you breastfed or bottle fed? So we really learn about the childhood and any adult illnesses. Were you given a lot of antibiotics? Did you grow up on a military base? Did you grow up around a lot of agriculture? So this is where things have changed a lot too, especially for California. There were a lot of farming and agricultural areas before, and then now they've changed, but we address water systems, toxins, exposures. So maybe that stuff was there like before you were born that your parents might have been subjected to, and it still actually might be around. But all those things like how it was acquired, your genetic factors, this all plays a part in this role of this timeline. And you can even fill out this own timeline. And I've done different iterations of this. If you search functional medicine timeline, you can download stuff. I'll be happy to send copies to anyone too. With Dr. Terry Walls, we cover a vitality timeline. So she actually covers different questions here, but it all matters. And then you can add in these lifestyle factors that you grew up with. Like, did you eat a lot of McDonald's like I did growing up? A lot of Coca-Cola. I got to carry the Olympic torch because it was sponsored by Coca-Cola. So I got a lot of Coca-Cola in my life, which I understood was like later on very hard to quit. So how was your sleep growing up? Were you a kid that just always had trouble sleeping? Did you always have digestion issues? Your approach to food, you can add this all in and it helps give you a better timeline. You can go back as far as you feel comfortable with as well. It has a section for current concerns. So you can break it down. What are some of those things that you're noticing with the mediators? And so it just all puts it in perspective as a whole as you go back and maybe see some aha moments. And what we like to do with this timeline too is update it. You don't need to throw everything at it at once because you might not remember everything, but update it as you go along. Like I generally, if I think of something, which I have lately, I'll add it to my timeline. I'll add it in there because I'll have an aha moment, which makes sense. In college years, I was in a moldy building, which might have explained why my symptoms were exacerbated more. So these are things to think about. You can like leave it for 6 months and maybe come back to it, but you don't have to do this all at once. So this is how we map out all this information to see maybe some significant areas of imbalance and then determine a concrete action of plan to address those areas. And so I love all this stuff because you can add so much detail. And maybe at some point we'll talk about the Walls vitality timeline because that goes really in depth of just what she likes to see. So where are you in your health journey? And I pose this question to everyone too, is just to kind of sit with it for a while. Are you in the place that you want to be? And then also taking a moment to just visualize where you want to be. And I think this is a big part of functional medicine as well, because we talk about always facing wellness. Like our goal, and even my goal as a health coach, is just to help people and guide them to like face wellness as opposed to illness, and being open-minded to what a wellness looks like. Because I can understand that many in our community have been disappointed by the care and guidance that they have received by the healthcare provider. I know I have, so I can relate. So what you're looking really for, and I hope this empowers you a little bit, is to take control of your care. There's a lot that you can do. There's a lot of information out there, and you can do those lifestyle factors that are part of functional medicine and change your life when it comes to those things, and always face wellness. And I just want to let people know your feelings are justified. All the fear, frustration, confusion, I get it. But no matter what you've been diagnosed with, please know that you're not hopeless. So you can see how everything is interrelated. So if you're a complicated person like me, who just felt like, oh my gosh, what is the next thing? What is that coming up? Like it was always something wrong. Like I get it. So just remember, you are not hopeless. And you have the power to take control of your care. So this is one thing that I learned when I talk about biohacking. It wasn't all the terminology of like, that can get into when it comes to biohacking, but I realized that I have the power. So I had given up a lot of the power because I was running around to doctors' offices. Like I would come home crying because it never made any sense. They didn't know what to do. But once I took control and realized that I could change a lot, that really put things in a different perspective. And I think these functional medicine principles sort of helped me to see that there's a lot going on. I mean, even if you're struggling to lose weight, there's this like huge graphic on the metabolic system that became a famous meme. And if you search for it, and it just makes people realize, I mean, this is complicated. I mean, thyroid issues, just stress, like metabolic stuff. So please, please just be kind to yourself when you're going through this process. And like, these are the stuff that we want to be here for. And I know Looms for Lupus is doing a wellness event. We want to get you the education so that it empowers you to be the best self that you can be. So it's just important to continue with that. And then I just wanted to include two of my health heroes from functional medicine. They've taken functional medicine principles to a whole new level. This is Dr. Terry Walls and then Dr. Dale Bredesen. These protocols really changed my life. I would not be here doing what I'm doing now with the brain power I have now without these two people. And I've also been really, really inspired by what they've done to like take this for fibromyalgia, because like both of them are sort of criticized by some of the national organizations early on, especially Dr. Walls, but she had to persevere. So I'm learning what it takes to persevere when you have ideas of how to change things for your community, like fibromyalgia, or even for autoimmune conditions. We have to look at things differently. So they've taken it upon themselves. They created the protocol, but they have tried to find their own funding for research. So they've been doing that. They've dug in to do it themselves. And people did not believe in them in the beginning, and they struggled to get it, but they're all about helping us and our communities at the grassroots level. So that's what's so amazing about Dr. Walls too, is she brought everything to the patients. So the national organizations, the providers were like, you're building false hope. She took it straight to the patients. The patients utilized it. They like had success, and she keeps on doing it. Same with Dr. Bredesen, always talking about it to our communities. So I think that's what's great about what we're doing with Looms for Lupus. We want to bring you this information directly because it's there. And it's important that we have these discussions, because I think we really need to think differently on how we say stuff and reframe things. I know it's controversial because we do want the cure, right? So research is always talking about the cure, but we're not talking enough about prevention and remission. So how can we is there a way to prevent autoimmune conditions? Are we putting enough research into prevention? And I know a lot of us who are managing our health, we don't want our next generation to go through all the battles that we've gone through. So let's reframe these conversations. And then for those of us that are, in these phases of autoimmune conditions, can we prevent cascades of adding another autoimmune diagnosis? Can we actually look at remission a little bit differently? So that, it's hard for me now seeing people in the lupus community pass away. And I'm like, can that be prevented? And so we have to start reframing our conversations. And I think this is a perfect time as a patient community to empower ourselves, to take that power back, have these conversations with researchers, doctors, national organizations, and not be scared to have these conversations. And as I close out, that's me. So yes, you know me from the Support Fibromyalgia Network, and I do have a nerdy health coach, although I'm kind of taking a little bit of a pause because I did special announcement now that I can talk about it. I got hired from Heal Community. So I've been doing group health coaching that's covered by insurance, which is huge. So doing group coaching and co-coaching with groups in Washington State, California, Texas, but people can utilize health coaching that's covered by insurance. So I'm excited. Thank you everyone for letting me present this. And now I'll stop talking.
Oh my gosh, this is amazing and a great information. So thank you for sharing that, Melissa, and for letting us know a little bit more of what you do and how you are helping and trying to help disseminate all this information to our communities. I think you touched on so many amazing things, and I'm just wondering, there's so many people that have logged on from all different places. So if we want to go on there and maybe say hello to a couple of people that are viewing, but also I'm wondering if anyone out there has already worked with a provider in functional medicine. And if you have, please share with us what your experience was, how you utilized it. I think we're going that route, Melissa, where you were talking about right now about the group coaching that you guys are doing with I forgot the entity that you're working with right now.
Oh, Heal Community.
Heal
It's
Community.
founded by James Maskell.
Yes. So with the Heal Community and how that's covered by insurances, I'm hoping that we go that route. And I think a lot of it has to do with us as patients being empowered, knowing this information and taking back that control. Because I believe, like you just said right now, a lot of times everything we have to go back to the root cause, right? And looking at the bigger picture and not just looking at what treatment can I take, but also what can I do as an individual to empower myself, get the tools that I need to help in that treatment plan or care plan that's going to make me feel better and perhaps going to remission or not add another condition to the list of the conditions that we may live with. So let's go to the comment section and see if anyone has utilized functional medicine provider, if they have experienced it, and what their comments are.
Okay, perfect. I know Melissa has, so I don't know if she's still watching, but let's like check in with everyone. I appreciate everyone allowing me to like present. It's different now being on the other side, isn't it? We're used to interviewing everyone, so I'm like, okay.
But you know what? Part of this tour that we're doing with Healthy Voices Fibromyalgia Impact Tour is about highlighting the impact that individuals or organizations are doing in their community. And you don't like to be on the spotlight, but this is the time for me to shine that light on you, because what you are doing and the tools that you have to educate us about these things need to be highlighted. So
well, and that's the important part, is just bringing it to our patient community, because it gets like, again, it's so disconnected, but you know, everyone is working and you see these terms, right? So like, what is functional medicine? What is integrative medicine? But they kind of seem like they're fighting with each other, or it's just this hassle. But what's the patient's perspective? So that's why bringing this information is so important. Like, let me bring up some of the comments. I'll go backwards. Oh, like shout out to Ken. I didn't even realize that he's watching. Hello. And he says prevention is so important. We tend to act when we need to, not when we could have. Exactly. And so I'm just, you know, we need to have more conversations about that, because again, we can't leave people, I guess, are like, and I say next generation, it's sounding like I'm really old. But it's like, you know, but I think Estella, you can relate too with like helping your family and your daughters. And so you want to make it easier for them to actually go through that, right?
Definitely one of the things that has helped me and be able to help my daughter is learning all the different tools that I can utilize, not just for myself, but also for them. But I think, you know, that's another good point that Ken made. You know, we need to focus more on prevention. What can we do to prevent, right, getting worse? And how can we help ourselves? So I think this, again, this conversation is super, super important.
Well, and I like that Colleen says that this is encouraging. Thank you, Colleen, that did. And we'll definitely send you links. Hello to Kelly. I'm glad you joined us today too. And so just post your questions if you have any, and we'll get back to you. I know we have some other updates too. Colleen says it's difficult to find a rheumatologist here. Now, this is really interesting to like, so we're changing now with fibromyalgia, because some of the rheumatologists, they can help you diagnose fibromyalgia, but they're relying now on primary care physicians or other providers, if it's a pain specialist, to really do the treatment protocols for fibromyalgia, which is why we're left with this gap. So I'm hoping with Project Echo, we can start to finally fill that gap. But in the meantime, that's why these conversations are important, because we're bringing you the education directly to the community, because we need to educate like ourselves and be patient advocates like to a whole new level, more than I would prefer, but there's been a breakdown. So we need to get more of the primary care providers trained on fibromyalgia. So if you are having that diagnosis, we have heard from other people that they've been turned away. So maybe it's looking at other providers. I wish, and I'm seeing a little bit more. So Colleen, if you want to check for a functional medicine provider, there's starting to be more coverage with insurance. But just even like words like integrative, lifestyle medicine. So look through some of those other providers, especially primary care, and just anyone. Naturopathic doctors are amazing too. I think they really understand fibromyalgia. But again, we're struggling with this insurance coverage right now. And so it's like really diversify who we have to send people to, because we're thinking whole body type of medicine. Who's
Yeah,
okay? What?
and I see, I want to do a little shout out to Clancy. She's one of my friends. She's a nurse, and she's saying that this is great information, that these are great tools for her patients because prevention is key. And I think, again, we don't focus a lot on what preventative medicine we can do and how we can help ourselves. So I think this is amazing. She also said even more difficult is to find a rheumatologist for her work comp patients. And a lot of times, a lot of work comp insurances don't cover this, even if we get regular payers to cover it. That's like another issue. But yeah, definitely. Thank you for these comments.
Oh yeah, and shout out to Mari. I know she's listening in. So we appreciate you being here. And I love the fact that we're talking too about personalized medicine. And Ken's here. We need to get this interview going, Ken, on pharmacogenomics, because that genetics will definitely help impact knowing that information in advance. Like if I was told some of my genetic stuff early on, I probably wouldn't have done some of the things or made some of those lifestyle changes early. And so it's really fascinating and how much information is out there actually, but how do we best provide it to all of you out there? And if anyone has suggestions and stuff, because I know Estella knows I can go off on a tangent talking about genetics and MTHFR, ApoE4, but I have to figure out how to present it the right way. Anyone that's been around me, I just be like, woo, there she goes. So, I mean, I think Estella has been helpful with trying to like ground me and be like, no, this is just enough.
Well, it's actually, these terms you hear them again, and I think it's important for us to know what these mean, right? So, what is pharmacogenomics, and how can we even utilize that to build that, that questionnaire you were talking about from grassroots? Like, what are we predispositioned with genetically from our family? What runs in our family, and do we even know? We might know what our mom tells us, what our grandmother tells us, what our aunts tell us, but genetically speaking, like, how is it that things will impact you, your behaviors, what you eat, where you live, what happened before in the area where you were living? I know here in Baldwin Park, it was all farmland, right? So how is that impacting us? When you look at a lot of these autoimmune conditions that are impacted by environmental factors, also what you were talking about you having that aha moment when you were going to school and how a lot of your symptoms were worsened because of the classroom where you were at, so we don't think about all of those things. And I love that you showed that diagram where you get to kind of fill in that blank and know, okay, this is why I am getting the issues or the symptoms that I'm feeling. And get that diagnosis, work with your providers. Once you get that diagnosis, it's not about how am I going to cure it, because a lot of conditions don't have a cure, right? We have lupus, for example, there's no cure. Fibromyalgia, there's no cure. So what can I do to help myself continue to live despite my condition and not let it control all of my life? And I think with functional medicine, we can do that. We can get these tools and empower ourselves and add other things like pharmacogenomics. How can I get to know a little bit more about my genetic composition and how my body will absorb these treatments that I am taking in, or these other things that are making my symptoms worsen? So I think functional medicine kind of gives us a control with the guidance of an expert like you to help us through our struggles and hopefully, get our lives back.
Well, exactly. And I mean, I loved the timeline for me because it helped me. I felt a little bit, I felt vindicated after filling it out because it had always been pushed away from providers that you're just too young. You're too young. And I'm like, I heard that for so long, but it made sense because 14 years old was this triggering event, but I had a history of being prepped for that besides head injuries, even dietary changes. Like I said, I consumed a lot of McDonald's, or I would play sports, and understanding now my genetic component that, I probably should have fueled up on avocados, not all the sugar that the teen moms were bringing afterwards, or all those bagels that I would eat and eat and eat, like carb overload. So it's no wonder from an early age, I was kind of set up. So that moment of like 14, the triggering event, I was like, oh, now like looking past all of that and back, I'm like, this makes much more sense of what was going on when I was younger. But it was so dismissed for so long as like, oh, it was just like a one-off, whatever. Because no one in my family had fibromyalgia, although I'm learning there's other autoimmune conditions. People just don't want to talk about it. There's other inflammatory conditions as the basis. Like inflammation is huge in all conditions. So I really saw myself getting vindicated by like, this is all connecting as to why I'm feeling the way I'm feeling. Regardless of what the doctors thought, I was like, I get it now. I connected the whole picture. So it made me feel vindicated, especially with histamine issues.
Yes, and Ken is saying your genetics hold a lot of the building blocks for prevention and treatment. And, it's true. The problem is not many of us know or are aware that there are ways for us to get all this information or connect with people that are willing to share this information to give us these tools. And I think that's what makes us a little bit different. Earlier, I was talking to Kelly Rosetta, and I was talking to her about there's a difference between us just advocating for a specific, being patient advocates, raising awareness for a specific illness or disease. And one of the things that I'm so proud of is the fact that our work together, Melissa, we don't focus on just one specific condition. We don't focus on just talking about, let's find a cure for this, because we know a lot of times it's unrealistic to do that. We actually work to help and empower the individuals that despite any condition that they may have, that there are things that we can control or learn and empower ourselves to help ourselves. Because at the end of the day, we're in the driver's seat, right? And I've heard this a couple of days ago. We are the CEOs to our body. We are able to either hire those people, that team that is going to help us build a better company within ourselves, with our bodies being our company, and we're able to fire also those that do not help us doing this. So whether you have a provider, a rheumatologist that's helping you that may not be really helping you or giving you the tools that you need, then you kind of have to go seek, right, for what is going to help you. And if functional medicine is a tool that you can utilize, why not hire that tool? Why not learn about it and also share it with everyone else? So, again, I'm just so proud of the fact that you love to share this information, Melissa, and your passion, you can see it. And I'm glad that you're sharing with us. And I hope that payers do one day start realizing that in order to have patient-centric care, and for the providers to realize that, they need to start looking and listening to the patient and giving us the tools that we need.
Well, exactly. And I appreciate everyone allowing me to do this. Obviously, I can talk nonstop about science and functional medicine and protocols and brain health. So it's definitely been fun. And I know we have some cool stuff coming up. I think next week. So we have the Social Butterflies Foundation on the Impact Tour. I'm excited to do an interview with them and learn about all their services, because they focus on fibromyalgia, on lupus and fibromyalgia organizations. So I mean, we're going to get at a lot of causes of overlap when it comes to that. I mean, that's what's intrigued me too with lupus, because fibromyalgia is so prevalent, and now we're learning with like other autoimmune conditions, it's even more prevalent. So that's why I always ask that question, why? And what are we getting at? What can we do about it for our communities? And then we have something special coming up on Sunday too.
Yes, so I'm just glad that we're able to talk about all of this, and I'm glad that people were tuned in today and to learn more about functional medicine. And the Fibromyalgia Impact Tour is educational. It's highlighting what people are doing in their community, and what you're doing is amazing, Melissa. And yes, you're right. This Sunday we're teaming up with David Ross, hashtag Zebra Health Chat, on Sunday at 11 a.m. And we are going to be talking about addressing how we can be better supportive, and how we can be part of that care team and collaborate with them. So this is one thing that is so important, care team collaboration. And I think if you add functional medicine to this, to our care, I think it would help a lot of us. So yes, I'm excited for that for Sunday. So if you guys have Twitter, please join the conversation about care team collaboration this Sunday at 11 a.m. Pacific Standard Time.
Yay, we're back with the Zebra Health Chat. So David's amazing to work with. Please check out our previous video interview with David and all the work he's doing for rare diseases. And he has a mental health group, right, for men?
For men, yeah, mental health for men. And I also just want to remind everyone, registration is now open for the first annual Looms for Lupus, Fibromyalgia, and Mental Health Wellness Day, and it is going to be hosted virtually so everyone can join. So whether you have a loved one or you are living with any of these conditions, it is free, it is virtual. It will be hosted on May 15th, which is Saturday, from 9 a.m. to 3 p.m. We will have amazing speakers, both talking about lupus and fibromyalgia and updates. We will have, special guests. We will have a lot of workshop and sessions that will be interactive, that will help you, again, take control of continuing to live your life despite of any condition. And also we're going to have a lot of giveaways. So please go register through Eventbrite. You can visit our website at www.loomsforlupus.org under the Wellness 2021 page. And if you're interested in collaborating with us and sponsoring, we are open with any of those, any suggestions, and please register. And this is, again, free for everyone. And Melissa's working with us on this amazing project. So we want to give you, again, all the tools that we can to help support you and your community.
Yeah, it's going to be a great event. So thank you for everyone tuning in. Please register. We'll add the links to the description of this video so that you can go register for that. It's May 15th. It is free. There are bilingual sessions that you can tune into. So definitely register and support the event. We're going to have a great time there. Also celebrating all that May has to come to. And I forgot, tune in Tuesdays to Training Tuesdays. We have another great interview for advocacy training for you. This person has a lot of experience going to Capitol Hill and doing legislation, clinical trials, and other types of research. So she's bringing it with Crystal in that interview. So tune in Tuesday. Okay, there's Juana. Actually, Juana put the thing, so you can register there at loomsforlupus.org. Shout out to Juana. We missed you on the tour. So I think we need time to relax from the tour.
Yes. Melissa, can you also share, there's another event that you're doing to raise funds for Advocacy Day for Fibromyalgia, and we can put on our pajamas for that. So I might still wear a little bit of makeup with my pajamas, I must add, because it just makes me feel good. But can you share a little bit about that and how people can join the team or create their team?
Sure. We're putting together the first Fibromyalgia Pajama Walk-in virtual party, so that's happening May 22nd. It is a fundraising event, but I definitely am working on the educational piece. So we have some people in line for making it a lot more fun besides music, Zoom games. So we're going to be playing some games too for giveaways. And then also looking at a sleep segment. So anything related to that, but obviously, it's at you stay at home virtual event. Please wear your most comfortable pajamas and you can feel comfortable with those fluffy slippers. So we'll include all those links in our description.
Thank you, Melissa. Thank you for oh, am I don't know if I'm muted. No,
Oh, no, yeah.
I just want to thank you again for giving us all this information about functional medicine, how we can incorporate it to our lives. It is much needed. We need to learn and get the tools that we need to continue to thrive. So thank you again.
Oh yeah, quick shout out to I just want to make sure to highlight Latoya. So I had a great conversation with her. If there's anyone in Alabama area, she is working really hard on a community level to be a better advocate in the community. So just resources and stuff and services she wants to get to the community. So if you are in Alabama and want to connect with her, please let us know. But
Yeah,
other than that,
yeah, that's amazing. I know I just read one of the comments, and I have to just kind of address this because Yolanda Valiente is saying, I appreciate the support because my family said it's my imagination. And unfortunately, so many people don't understand. We are here for you. We understand you. And I'm glad that you connected.
yes, thank you. It is not, we aren't imagining this. So we'll have to get better. And that's where that I said on that timeline, relationships, that is one of the hardest areas for me. So, you know, and I can relate to a lot of you. So it's something that work. But if that's an area that's difficult for you, then focus on what you can do. So the sleep, relaxation, some movement, nutrition. So those are things that you can focus on as well to improve and maybe get to this relationships a little bit down the line. But thank you everyone for tuning in to the Fibromyalgia Impact Tour on functional medicine. We will see you next Friday and we'll definitely check us out. Okay, bye.